Hello, these are the 3 most effective things you can do for pain around the kneecap itself. We are Witty, Pask and Buckingham, Chartered Physiotherapists in Northampton. We have been the leading physiotherapy clinic in the region for 40 years. We treat bone, joint, muscle, tendon, ligament and nerve issues all over the body. Using manual and manipulative treatment techniques, shockwave and exercise regimes, we work to get you back to full health as quickly as possible. Pain around the knee can be quite difficult to pinpoint. Most people find it hard. If you've got pain actually within the joint itself, if you've got pain in the back, if it feels unstable, if it's locking, if it's giving way, if it's suddenly swelled up, if you had a trauma, a twist, a bang on it, a fall, then those are the sort of things that cause injuries within the knee joint itself to the major ligaments and the structures like the menisci. Those are things you need to get checked out. You need to get them checked out as soon as you can. However, if you have a gradual, a build-up of pain, more around the actual kneecap itself, usually it's on this inside edge is the first port of call, then it can be down on the bottom part towards the patella tendon, the stringy bit at the front there. Sometimes it could be over the outside on this top edge, and sometimes when it's really rotating around, you can get pain in the squidgy fat pad part on the front lateral aspect usually. These are the sort of things that are caused by malalignment, the way in which the kneecap is running on the front part of the knee. And generally it's caused by tightness of the structures on the outside here, tightness of the iliotibial band and the lateral retinaculum, and relative weakness of the muscles on the inside. And there's lots of things you can do yourself to help those, which we'll go through now. The pattern of pain is it can be stiff to get going. Sitting for long periods is the real thing. This comes under the colloquial name of cinema-goer's knee. So sitting for periods of time on planes or cars can build up a sort of a pressure and you feel like you've got to stretch that leg out. It can also be sore after being on it, particularly on stairs, and lots of walking up hills can make it also quite sore because of the way in which the kneecap just isn't running properly in the front of the thigh. Range in the knee is generally good. You can generally flex it completely and there's no real pains on that, and you can lock the knee joint out at the end of the range, again full in without pain. With issues inside the knee, the meniscus, ligaments, that's quite painful. In kneecap type pain, it's not a problem. As I said, the cause of this type of issue is changes in the way in which the kneecap slides and glides on the front of the knee itself. It should be sliding straight up and down as the knee bends. In this case, what happens though is the lateral structures pull it off to the side and you end up with the kneecap tilting and being pulled over this way, and that's what causes the pain. Iliotibial band rolling is a very effective way of helping this yourself at home. Good solid roller rather than a squidgy foam one is most useful. You lay on the roller using your elbow to support yourself with. Ensure you're fully onto the roller with the bottom leg pretty much straight, maybe bent a couple of degrees, but that's fine. Keep well over and forward with your top hip and use the top leg in front to help guide you. Move until you feel those tight areas, and then you'll find a spot, and at that point you need to linger on it and work into it, rolling, stretching, easing into that tissue. More often in lateral kneecap pain, you find it's this lower half of the band, the iliotibial band, that is the most tight area. So make sure you get right down towards the knee itself. 2 minutes, a couple of times in the day. It will be painful, it will be sore, but it's the best way to release off that tight, fibrous fascia. Exercise 2 is a hip flexor stretch. The hip flexors attach into the iliotibial band and add to the tightness. Sitting jobs make this worse. The best way to stretch this is in a kneeling position, kneeling on the knee to be stretched, placing a pad or a pillow underneath it, having the other leg in front of you, and you can use the roller you've been using as a support to keep your balance. You start upright and you draw your core muscles in to keep the pelvis level. Keeping that tension, keeping that tightness, you then lean forwards into the stretch, which you'll feel in the front part of the hip. If you let it go, if you don't hold the core well enough, you won't feel the stretch, it won't be anywhere near as effective. So the key is always keeping your tummy tight, keeping your glute muscles tight, and just pushing forward through the hip as far as it needs to feel that tension in the front part of the hip itself. 2 minutes, twice a day, will get this lengthened out. Exercise 3 is a self-mobilization technique for the fibrous tissue on the outside part of the kneecap that comes from the iliotibial band to the kneecap itself. It's called the lateral retinaculum. If you sit with the left knee, which is the left knee we're treating here, slightly bent, and you place the heel of your right hand on the inner edge of the kneecap and push it upwards towards you to tip the outside edge of the kneecap outwards. You then use the fingers of your left hand to work into the tightness on the outside of the kneecap to free that fibrous tissue. 2 minutes with a bit of moisturizer, a couple of times a day to free that up. You have to push quite hard. So if work on those exercises for a few weeks. If it's not fully settled down, then we need to look at it further. It needs to be assessed by a Chartered Physiotherapist. Sort of things that we'd look for is the whole biomechanical chain from the back through the hip, down through the knee obviously, and down into the foot, and the way in which you're using those, or any dysfunctions in areas like the lumbar spine, the sacroiliac joint, the hip, and then the way in which you control the foot, all impact in to the knee area itself. We also need to look whether there's any actual damage inside the kneecap, and this is underneath that cartilage surface, or maybe around on the fat pad being pinched and scarred. So lots of other things that we need to assess to check out further problems if the exercises in the first few weeks haven't settled it down.